outpatient coordinator at the Village Southwest Care. Today will be presenting all the programs that we offer. Um, I mainly specialize with outpatient, but I will include our Families in Transition program, which is in residential. So to begin with, I'll start share screening. Okay. All right. So like I said again, my name is Leonard Ross, and I'll be presenting our programs. This is our table of contents, so I'll be discussing the REACH program, adult mental health, our postpartum women's program, our medicated assistant treatment program, our care coordination team, our families and tradition team, transitions team, which is our fit team, and other services that we offer. All right, so let's start off with REACH. Okay. REACH admissions criteria: you must have a substance abuse or co-occurring diagnosis, must be 18 years of age or older. Services provided is individual therapy, substance abuse therapy, family therapy, which is optional, but we do have access and we can provide family therapy for clients that are in this program. We also provide urinalysis, seeking safety, trauma therapy, which is also optional. When with something like seeking safety, the reason why we put optional because there may not be a clinical need for it, but we do what's known as a PCL5 at the beginning of admissions, which determines if they may need seeking safety therapy. Okay. We also offer. Oh, wait a minute. Sorry. We also offer this program as an aftercare for residential clients and clients no longer receiving services and active treatment in outpatient, regardless of what the program is. Okay. The treatment team consists of a therapist, a peer specialist, and a case manager. The therapist meets one time weekly. The peer specialist meets once times weekly, and the case manager meets two times monthly. And the length of stay is 2 to 6 months, and the urinalysis is two times monthly. So two things about that. With the case manager, this is just like the basic or the bare minimum amount that they can meet monthly. If there's a need or if they're working on something else, they can meet more than twice a month. The same thing with urinalysis. Though this is just a minimum of twice monthly, clients can be tested weekly or up to 3 times a week or as needed. Okay. The next program we have is our adult mental health program. This is a relatively new program. The admissions criteria for this program is must have a mental health or co-occurring diagnosis, must be 18 years or older of age. Services provided is individual therapy, monthly sessions with the psychiatrist, medication, case management, and peer services. The treatment team consists again of a therapist, which meets one time weekly, a peer specialist, which meets one time weekly, a case manager, which meets two times monthly. Length of stay is six months to a year. Urinalysis one time monthly. Now, the reason why we still do a urinalysis in this program, even though it's a mental health program, is because we do understand that though they're in our program for mental health, there may be some unidentified or unreported substance abuse issues. So what we do is we make sure we do at least one drug test a month in case they're taking the medication and we find out they're doing substances as well with the medication, which could lead to negative effects for the client. So we just want to make sure everything's in order, and that's why we continue with urinalysis, even though this is a mental health program. Okay. Then we have our postpartum women's program, which is our PPW program. Admissions for this criteria, you must have a substance abuse or a co-occurring diagnosis, must be 18 years or older, must have given birth within the last 6 years, and this is only a female-only program, so no males are allowed in this program, regardless of what. Individual therapy is offered in this program. Substance abuse therapy is offered in this program. Family therapy, again, is as needed. Parenting is also offered in this program. Peer services, case management, urinalysis, and again, seeking safety trauma therapy as needed. In this program, You will be assigned a therapist, which meets one time weekly, a peer specialist that meets 2 times monthly, a case manager that meets 2 times monthly, length of stay at least 3 to 6 months, urinalysis 2 times weekly. Okay. So before I go on, matter of fact, let me mention this. The thing about PPW, what is great about PPW is in the event, which I'll speak on CCT later, if we have a client that does need, that's receiving CCT services, we can also link them to PPW services if there's a clinical need that arises while they're in that program. Okay. So the next program we have is the Medicated Assisted Treatment Program, which is our MAT program, or um, State Opiate Response Program. Okay, to be in this program, you must have an opiate or a stimulant use, substance abuse, or co-occurring diagnosis. The stimulant use diagnosis is actually a great thing that they actually implemented in the middle of last fiscal year, which also opened the doors for more clients to be able to receive the services in this program. Again, you must be 18 years of age or older. Services provided is individual therapy, and that's optional in this program. Now, that might seem strange, consider this is a substance abuse program, but however, in the SOR guidance, if a client wants to receive the medicated assisted treatment and do not want to receive therapy, that should not be a barrier for the treatment. So substance abuse therapy is also optional. Family therapy is also optional. Parenting is something we're trying to implement because, as we've seen on the news so many times, kids have been involved. I should have put optional here, but parenting is something we want to make a requirement of this program so they can understand the effects of what their usage is doing to the families. Okay. Peer services is also a requirement in this program. So even though the state doesn't necessarily want us to use therapy as a barrier or the lack of wanting therapy as a barrier, again, we're clinical. There has to be some kind of clinical services. So that's why we still keep the peer services in place. Case management and urinalysis. Again, seeking safety trauma therapy is also optional, but this would only be for the clients that elect to have the individual therapy or the substance abuse therapy. Also with MAT, we have residential treatment as needed. So a lot of the times clients can go directly into residential with MAT diagnosis. And once they come out, they can step down into our outpatient services. The treatment team for this is a therapist, which meets one time weekly, a peer specialist, which meets one time weekly, case manager 2 times monthly. Length of stay in this program is 12 months or longer. Urinalysis is 2 times weekly. However, this program has phases. So this particular setup here is phase one, where you meet every week on a weekly basis. So then they moved on to phase two, where then you meet every other week. And then the final phase will be where you meet on a weekly basis, which is more like, I guess you could say, the aftercare stage. Um, One little interesting thing we have noticed is that we've had clients in this program from STR to SOR. So the ones that are really serious about this treatment, they tend to stick around. The only downside that we have noticed is those clients that stick around, unfortunately, they stay in the program so long to the point where they become unsuccessful discharges. So that's a little, I guess you could say, a tad bit that we found in the numbers, and we're trying to figure out how we can fix that. One suggestion we've had is to maybe hire a peer that acts as a bridge between residential and outpatient. That's something that's still in conversation. The reason why we're looking at that, because we also feel those clients that go back and forth, the reason they're going back and forth because there's an adjustment going from a residential treatment to an outpatient treatment. And of course, that main adjustment is that newfound freedom, not that person over you anymore to, watch what you're doing or make sure you're doing what you're supposed to. Okay. Um, then we have our care coordination team. You must have an opiate diagnosis or open child welfare case and or a co-occurring diagnosis. Must be 18 years of older. So we do have a third care coordination team that you don't have to have an opiate diagnosis for. So I should have mentioned that. Services provided is case management, urinalysis, and peer services. Now the thing about the CCT program, because it's a care coordination program, it can we can basically link them to services for treatment, whether it's the REACH program or PPW. Not even in some cases, I'm sorry, yeah, even in some cases we've linked them to SOR MAT. The guidelines for CCT is must meet with the client at a minimum of 3 times a week. So that's why the care coordinator, sometimes it rotates out depending on the relationship. So the care coordinator can meet 1 to 2 times weekly or as needed. A peer specialist can meet 1 to 2 times weekly or as needed. But your analysis are to be conducted 3 times weekly. Then we have our Families in Transition program. Yes, yes.
Hi, this is Sky from Broward Mental Health Coalition. Just a really quick question on the care coordination teams. You said
Okay.
you're doing urinalysis 3 times weekly. You're not, I don't think you really, that means you're making people pee in a cup 3 times a week.
Okay.
But you're not, there's no way.
Well, that's something we're shooting for.
3 times,
Well, it's kind of because the reason why they're going 3 times a week now, we can always make that adjustment, but they're being seen 3 times a week for the CCT requirement.
so in theory, they can get up to 3 times a week urinalysis, but that's not the standard that we look at. We don't, as the program is, they're
Okay.
not getting drug tested 3 times a weekly. We're lucky if we get them in like twice a month or once a month.
Okay. Okay.
Okay. Just so you know, because this makes it look like it's mandatory for 3 times
Okay.
weekly, and it's just not mandatory for 3 times weekly. But go ahead. Thank you, Leonard.
No. Thank you. Thank you. So I can make that adjustment for future presentations so that way it doesn't come off misleading or misinterpreted. So no, thank you. Thank you. All right. Anything else before I move on?
No, sir. Thank you.
All right. So then we have our Families in Transition program. So this is a residential program. To be admitted in this program, you must have a substance abuse diagnosis, must be 18 years old or older, must have an open child welfare case, must meet residential criteria. Let me put this out there. This is the program that I believe you all are calling the Mummies and Me program. But this is we call it Fit Families in Transition. Now with this program, the kids, I believe, if I'm not mistaken, eight or younger are allowed to come into treatment with the clients. So the services provided in this program is assessment and evaluations, MAT programs, psychiatric services, wellness and recovery planning, individual counseling, family therapy, new beginning groups, relapse prevention group, seeking safety, codependency group, peer group, problem solving, risk reduction counseling, parenting skills training, specialty groups of smoke cessation, babysitting, vocational services, which is our IPS services, which helps the families transition back into society, find jobs, and things of that nature. On-site psychiatric and medical services, and of course, as mentioned previously, clients can always be stepped down into our REACH program as an aftercare. All right, Fit Continue. In this program, individual therapy is offered 1 time weekly or as needed. Same thing with the peer specialist. Case manager, 1 time weekly or as needed. Okay. Urinalysis are provided basically upon staff's requests. So they're provided, I guess you can say, randomly. Okay. So other services we offer is admissions. So with our admissions process, you would send a referral information to Israel Gonzalez. I provided his email address. The information needed for all admissions would be the client's name, the most recent contact, list of any medication, the purpose of the referral, We prefer warm handoffs when coming from another facility or program. All services are offered for free to clients without insurance. Clients with Medicaid, Medicare, or private insurance will be billed. We provide services from county line to county line. We do have telehealth options for outpatient clients. Monthly reports are provided. Any questions?
No, Mr. Ross, this is excellent. Thank you. So if someone wants to refer to any of these programs, who would they call to talk to as their point of contact?
Israel will be the best. He does admissions for residential and outpatient. So that contact of Israel Gonzalez will be the best person to contact.
Okay, great. Thank you so much, Mr. Leonard. We appreciate you.
No problem, and thank you. Is there any more questions?